My name is Leslie Wang, and in this video, we will be going over glaucoma, specifically what glaucoma is, the different types and symptoms of glaucoma, and the management and treatment of this disease. Glaucoma is an eye condition that has multiple characteristics. Primarily, glaucoma can damage the optic nerve which connects the eyes to the brain, allowing us to see. When this nerve is damaged, it causes permanent vision loss. There are various types of glaucoma, and they are often classified as open or closed-angle glaucoma. Open-angle glaucoma is when the chamber in the anterior angle is open, so that aqueous humor can flow out of the eye. Closed-angle glaucoma is when the angle is closed, blocking aqueous humor from flowing out. Unlike open-angle glaucoma, closed angle is less common but a more urgent situation since trapped aqueous can lead to quick deterioration of vision. There are multiple factors that help determine whether someone has glaucoma, so doctors will conduct optical coherence tomographies, or OCTs, visual field tests, intraocular pressure or IOP tests, and central corneal thickness tests for evaluation. Glaucoma is also incurable, but can be managed with medication and surgery. Primary glaucoma is when there is no known cause for glaucoma, while secondary glaucoma is when there is a known cause, such as from trauma or medications. There are also risk factors that can contribute to glaucoma development. These include old age, having a family history of glaucoma, diabetes, being of African descent, or having already high IOP. For reference, normal IOPs can range from 10 to 21 millimeters of mercury. Abnormally higher IOP with other indications may suggest the presence of glaucoma. However, it is important to take into account that high IOP is not the defining sign of glaucoma, as patients with normal tension glaucoma present with normal eye pressures. Some common signs and symptoms of glaucoma may include the appearance of cloudy eyes, eye pain or redness, blurry vision or vision loss, seeing halos around lights, or headaches. Eye pain and vision loss may occur more rapidly in cases of angle closure. However, glaucoma is usually painless, which can cause patients to not even notice that they have the disease. If there is suspicion that glaucoma may be present, be sure to seek medical attention. For reference, here is a visual to simulate what a glaucoma patient's vision may look like, but please note that this example is not representative of all glaucoma patients. As for treatments, medications are usually prescribed before surgical procedures if applicable. Common eye drop medications include latanoprost, timolol, dorzolamide, and brimonidine. Latanoprost is an eye drop medication that lowers eye pressure by allowing the aqueous fluid to leave the eye. Common side effects include lengthening and thickening of the eyelashes and fat atrophy around the eyes. Timolol is an eye drop medication that slows down the production of aqueous fluid, so eye pressure can decrease. Patients who have asthma and lung disease should, however, avoid this drug. Dorzolamide is another medication that decreases aqueous production, as lowering pressure may require the patient to take multiple medications at a time in order for effects to be seen. Patients who have kidney disease or are dehydrated should avoid taking dorzolamide. Brimonidine is also a medication that lowers the production of aqueous fluid and increases uveoscleral outflow, or aqueous drainage. Side effects of this medication include having a high chance of developing an allergy after chronic use. Allergic reactions may present as red eyes or puffy skin around the eyes. As for surgeries, laser treatments are usually given before more invasive procedures. For closed-angle cases, a peripheral iridotomy is done, where an ophthalmologist will use a laser to make a hole in the iris so aqueous fluid can come from behind to relieve pressure buildup inside the eye. For open-angle cases, laser trabeculoplasty can be done, where a laser is shot into the chamber angle and trabecular meshwork to open them up, allowing aqueous fluid to get inside. Sometimes a glaucoma procedure may be combined with cataract surgery, where a stent is implanted to open up the drainage system at the angle. When laser treatments are ineffective, trabeculotomies can be performed, or glaucoma drainage devices can be implanted. A trabeculotomy is when a passage is created from the inside of the eye to the surface of the eye, which opens up Schlemm's canal and the trabecular meshwork, allowing fluid to drain outside of the eye. This ultimately creates a reservoir for the aqueous fluid outside of the eye, known as a bleb. Another operation involves implanting a glaucoma drainage tube, where a reservoir is implanted with a one-way valve tube that goes into the anterior chamber. As shown in the left picture, this device will prevent eye pressure from being too high, as the tube will drain aqueous fluid to maintain normal eye pressure. Thank you for watching this video. For more information about glaucoma and other eye conditions, please visit these websites for reference.